Bismillahirrahmanirrahim. Welcome to my channel, Science of Life with Dr. Muhammad Yousaf. We are discussing the physiology of heart, cardiac physiology, and today we will talk about especially the effect of nervous system. We will talk about the regulation of cardiac activity by many other mechanisms, but especially the role of nervous system in the regulation of cardiac activity. But before that, one hadith. हुजूर सल्लल्लाहु अलैहि वसल्लम ने फरमाया ला यदखुलुल जन्नत कातिउन। बुखारी और मुस्लिम दोनों में ये हदीस वारिद हुई है। ला यदखुलुल जन्नत, नहीं दाखिल हो सकता जन्नत में, नहीं दाखिल होगा जन्नत में, कातिउन, कतई रहमी करने वाला, कतई रहमी करने वाला जन्नत में न जा सकेगा। कतई रहमी यानी रिश्तेदारों से और ताल्लुक वालों से, क़राबत वालों से बुरा सलूक करने वाला। सिला रहमी उसको कहते हैं, क़राबादारों रिश्तेदारों से अच्छा सलूक करने वाला, ये सिला रहमी है। और ये इतना अहम हुक्म है कि क़तई रहमी के इतनी बड़ी वहीद आई है कि वो जन्नत में ना जा सकेगा। अल्लाह पाक हमें समझ अमल की तौफीक अता फरमाए। रिश्तेदारों से, ताल्लुक वालों से अच्छा सलूक हमें हुक्म दिया गया है। अल्लाह पाक हमें समझ अमल की तौफीक अता फरमाए। So we will talk about the regulation of heart activity by some mechanisms, especially nervous mechanisms. Intrinsic regulation of cardiac activity we have talked about. It is the homeometric regulation. It is also known as homeometric regulation. That is, it is actually the property of cardiac muscle which we have discussed. Heart adjusts its contractility by itself. That is the what we call as Frank-Starling's law. That is, when the greater the venous return, greater will be the cardiac output, cardiac activity, force of the contraction of the heart, and cardiac output depends upon that. So greater the venous return, greater will be the cardiac output. This is the homeometric regulation. This is Frank-Starling mechanism. So again, the expression of the Frank-Starling mechanism in the form of cardiac output is always equal to venous return. So normal cardiac output is 5 liter, and this normal intrinsic mechanism, homeometric regulation, can increase the cardiac output up to 13 liters. This is the inherent property of the cardiac muscle itself. This is homeometric regulation we discussed in the previous lecture. Just we have named it as homeometric regulation. There are some other mechanisms which affect the cardiac activity, especially, for example, inspiration and expiration. It increase and decrease the venous return. So this will cause the change in the cardiac activity as well. That is known as heterometric regulation. For example, adjustment of the cardiac contractility due to change venous return due to inspiration or expiration. As you know, that is, during inspiration, venous return may slightly decrease because of the negative pressure. During inspiration, negative pressure is created in the thoracic cage, so that may reduce the venous return. We will discuss when we discuss the regulation of cardiac output and venous return there. It will be discussed again there. What is the role of this inspiration and expiration? What is the effect of inspiration and expiration on the venous return and cardiac output? Here, very briefly, that is, during inspiration, there may be slight decrease cardiac venous return, and thence there will be reduced force of contraction and cardiac output as well. And opposite, during expiration, venous return may slightly increase, and then force of contraction as well as the cardiac output may decrease. These are not very important effects, very important regulator of the cardiac activity. Important regulation, extrinsic regulation. Out of extrinsic regulation, very important regulation is this nervous regulation, effect of nervous system. As you know, heart is supplied by the visceral nervous system, autonomic nervous system. Heart is supplied by the sympathetic nerves from the sympathetic chain. आगे diagram में हम देखेंगे. Sympathetic nervous system, generally sympathetic system activates the activities of the heart in many aspects. We will see what are the aspects of those increased activity by nervous system. Here we are just listing. That is, the sympathetic nervous system increases generalized activity, increase in the cardiac activity. Sorry, this should be increase, one word, increase cardiac activity. And parasympathetic nervous system, that generally decreases the cardiac activity, that decreases the, especially heart rate is decreased, we are going to see. So nervous system, these two limbs of the autonomic nervous system, sympathetic nervous system and parasympathetic nervous system, they oppose each other, almost they oppose each other. This diagram will show you the cardiac output curves. We will explain these curves at due course of time when we discuss the cardiac output, but here just this is the cardiac output, that is cardiac output according to plotted against the right atrial pressure. Here you may not understand it. Right atrial pressure in normally it is 0, and when there is more venous return, cardiac right atrial pressure also increases, cardiac output should increase. So normal, at normal, this green curve is the normal cardiac output curve. That is, at normal right atrial pressure 0 millimeter of mercury. You can plot it. It will be about 5 liter. You can plot it here. That is, at 0 millimeter of mercury, cardiac output is 5 liter per minute. With the increasing right atrial pressure, for example, increased venous return, or there are some other factors as well, increase venous return, because increased venous return will increase the right atrial pressure, that will increase the cardiac output, and it may go to up to 13 liters. It is the inherent properties of the cardiac muscle. But anything which increases the cardiac activity, external sources which increase the cardiac activity, for example, sympathetic nervous system, that will increase the pumping ability of the heart, and that we can hyper effective heart, that will be pumping ability of the heart is increased. And there may be some factors which reduce the cardiac activity, that result into hypo effective heart. This is another very beautiful diagram. That is, this curve is this green dot bold curve is the normal cardiac output curve. It is again the 13 millimeter of 13 liters against the right atrial pressure, normal cardiac output 13 लीटर तक जा सकता है. But with the sympathetic system stimulation, more sympathetic stimulation, there is more cardiac output, more this curve has shifted to the left and upward. That is, at 0 millimeter of mercury, instead of 5, it may be 6 or it may be 7, or in the case of maximum stimulation in 0 millimeter of mercury, it may be 15 or more than that. So cardiac activity is increased with the sympathetic stimulation, and this lower curve is the parasympathetic activity, that reduces the this shifts the cardiac output curve toward the right and lower side. So the parasympathetic stimulation reduces the cardiac activity. At 0 millimeter of mercury, cardiac output with parasympathetic stimulation, it may be only 1 liter. At 4 millimeter, normally it should be 13, it is only 3 liter. 6-7 liters with parasympathetic. So both nervous system, that is autonomic nervous system के both limbs, sympathetic and parasympathetic, they tremendously affect the pumping ability of the heart, or cardiac contractility, or the activity of the heart. This is how the nerve supply to the heart is there. Sympathetic chain, there are sympathetic a chain of sympathetic ganglia on the both sides of the vertebral column, on both sides of the spinal cord, sympathetic, and the fibers going from the sympathetic ganglia to the heart, they are responsible for the sympathetic supply of the heart. And parasympathetic supply of the heart, this is the parasympathetic supply of the heart, are the two vagus nerve, right and left vagus nerve. They are primarily supplying the SA node and AV node. Both are supplying SA node. This one is supplying the SA node, and the left one is supplying the AV node, and maybe some muscle, some supply to the muscle. Primarily they are concerned with the regulation of the nodal activity, SA nodal activity, or AV nodal activity. So the parasympathetic are the vagi, two vagi, they supply the heart, and the sympathetic, that is sympathetic chain, this supplies the nodes as well as the muscles as well as the blood vessels, etc., around the heart. So this is how the nerve supply to the heart is. Now the effect of sympathetic system and parasympathetic system. Effect of sympathetic first. This is more powerful system for the heart. It is, that is, I have drawn this very bold arrow in upward direction. That is effect of sympathetic system, tremendous increase. This very bold arrow, that is tremendous increase in four aspects of the heart. One is there is increased heart rate. Sympathetic system increases the heart rate. Normal heart rate is say 70 beats per minute. So with the sympathetic stimulation, heart rate may increase. It will be 100, it will be 120, or it may be 140. So increase heart rate, and this is known as positive chronotropic effect. This is also known as positive chronotropic effect, increase heart rate. And we will see that is the negative chronotropic effect is that of the effect of parasympathetic system. Vagus nerve stimulation reduces the heart rate, causes bradycardia. Decreased heart rate is also known as bradycardia. Increased heart rate is also known as tachycardia. So sympathetic stimulation causes tachycardia. That is positive chronotropic effect. It increases the heart rate. So normally say if the heart rate is these two curves should be there, and there are three curves instead of two curves, so heart rate has increased. So force of the contraction is also increased. This bold arrow is applicable to all these four factors which we go on to see. So the force of the contraction is also tremendously increased by the sympathetic system. This is known as positive inotropic effect. These are the main two powerful effects: increase heart rate and increase force of the contraction of the heart. Both, you can imagine, both should increase the cardiac output. That is, increase heart rate. Cardiac output depends upon the heart rate. Normally 70 ml of blood is pushed out of the ventricle into the aorta, and when heart rate is 70, instead of 70 it is 100. So 70 multiplied by 100, cardiac output will be 7 liters. But force of the contraction, normally 70 ml is pushed per contraction. If forceful contraction occur, instead of 70, it may be stroke volume. That is known as stroke volume. That may be 70, 80 or 90 millimeter of mercury may be pushed. So that will also increase the cardiac output. So positive inotropic effect and positive chronotropic effect are the powerful effect of the sympathetic system. Besides that, there is increased conduction velocity as well. Not only the heart rate, number of impulses generated from the SA node, they are increased, their conduction velocity is also increased in the myocardium, which we normally it is very fast conducting muscles, and that conduction velocity is also increased. So dromotropic effect, that is known as dromotropic effect. And fourth one is it becomes more excitable. Heart rate is being increased, heart muscle myocardium becomes more excitable, and it is known as bathmotropic effect. So increase excitability, but especially these are the two important, and less important are the, that is the dromotropic effect and bathmotropic effect as well. So sympathetic system increases the heart rate, increases the force of the contraction, and increases the conduction velocity of the cardiac impulse, and increases the excitability of the heart. All these will lead to increased activity of the heart. So that is the effect of the sympathetic system on the cardiac activity. Now the parasympathetic vagi, two vagi, as I said, this arrow is downward, so it is reducing the cardiac activity, and this arrow I have not drawn that bold. It is a bold, it reduces the, so it is a powerful effect is on the heart rate. It has got the effect opposite to sympathetic system. It decreases the heart rate. So the normal heart rate is this one, and this will lead to more time consumption per contraction, per cardiac cycle. More time will be, normal time is 0.83 seconds, it may be 1 second. So total time is increased. So heart rate will be reduced. This is known as bradycardia. So it is negative kind of negative chronotropic effect. Conduction velocity is also reduced. Velocity of conduction, especially AV node. AV node pe there is an AV nodal delay. Previous lecture we were talking about. There is delay in the conduction in the AV node that is further reduced on sympathetic stimulation. Sympathetic further increases their delay in the AV node, and velocity of conduction is also reduced. So it has got the effect opposite to sympathetic system. Force of contraction is also reduced by increasing the permeability of the potassium ions. Forget it. We are simply listing the cardiac the factors which affect the nervous activities, which affect the cardiac activity. So it reduces force of contraction. Again, it is questionable. Rate of contraction, it has bradycardia. Vagus nerve stimulation causes bradycardia. This is the very powerful effect on the heart rate. So when bradycardia is there, of course, naturally there will be reduced cardiac output and reduced blood pressure, etc. We will see when we discuss the circulatory system. So sympathetic and parasympathetic system both affect the cardiac activity. Now this diagram will explain all that. This is the normal, say this is normal action potential, for example, in SA node. SA node, this is the pacemaker potential, and then the action potential we saw in the previous lecture. That is rhythm in the absence of the nervous effect, inherent properties of the cardiac muscle. This is the SA nodal activity. But when there is sympathetic stimulation, we can see that is in the three. These are the three per unit time. Say, for example, in the same time, 1, 2, 3, 4, 5, 6, 7. It has doubled. Heart rate has doubled. SA nodal potential have doubled with the sympathetic stimulation. So heart rate will increase. Firing rate, generation of action potential from the SA node, number of impulses generated per minute, they have increased. So heart rate will increase, and the force of contraction, of course, and the vasomotoric effect, all those effects will occur. This is only heart rate. This is SA nodal activity is being recorded here. So SA nodal activity, tremendous increase, very high rate, heart rate will increase. And if parasympathetic stimulation is there, it will inhibit the SA node. It will reduce the number of impulses generated per minute. So bradycardia will be produced instead of three complexes. There are only two complexes. So there is a reduction in the heart rate. That's all about the effect of sympathetic and parasympathetic system. And this graph, which I have already shown, is this is the normal cardiac output curve. At 0 millimeter of mercury, normal cardiac output, it is 5 milliliter. If there is sympathetic stimulation at 0 millimeter of mercury, it will not be 5, it will be 7 or 8. And at 4 millimeter of mercury, it will be about 15 liters or more than that. And with the maximum sympathetic stimulation, it may go to 25 liters. That occurs during exercise when there is sympathetic stimulation, as well as the inherent Frank-Starling law mechanism and sympathetic stimulation and more venous return, and finally the cardiac output may go to 25 liters. Normal cardiac output is only 5 liters, that is at 0 millimeter of mercury. So the cardiac output may go to 25 liters. In well-trained athlete, there is hypertrophy of the heart as well. We will see when we discuss the cardiac output regulation. In well-trained athlete, there is hypertrophy of the heart. Force of the contraction, force generated by the ventricle is tremendously more in the athlete as compared to normal people. So more force generated and more powerful contraction will increase the stroke volume and increase the cardiac output. And in those, instead of going to 25 liters, it may go to 30 liters or even 40 liters. In marathon runner, cardiac output may go to 40 liters. So that is the effect of sympathetic system. And opposite effect of parasympathetic system, it will be curve will be downward. That is at 0 millimeter of mercury with the parasympathetic stimulation, cardiac output will be only 2 liters. Or at 4, it will be only 6 liters instead of 13 liters. So parasympathetic system reduces the cardiac activity, and sympathetic system enhances all aspects of the cardiac activity. So though heart muscle is automatic, it can homeometric regulation is there, that is sufficient for the routine life. But there are instances when there is more requirement on the cardiac output, for example exercise or athletics, there then the sympathetic nervous system contributes, or parasympathetic system contributes in its way for the regulation of the cardiac activity. So that's all about today's lecture. Next video we will discuss very important aspect of the pumping of the heart, cardiac cycle. We will start in next lecture, and please do share all these slides, and so that most of the people can join in the next lecture. So cardiac cycle we are going to discuss, and please subscribe and share and like this video. And if you have got some query, some questions, you can ask in the comment section. I will have a session for the question answer session we will conduct, inshallah ta'ala. Hope you have understood it. Thank you very much. See you next time.